My passion over the years has become education. So whether that's patient education or educating other healthcare providers, not from like oh, I know everything type of way, but just like, I think it's so important to get this information out. So I'm just happy that you have me on here and that we're talking about it. I was really resistant in the beginning to try to do therapy online, but I felt like it was one of those like signs from the universe, like so many people are contacting me and I'm turning them away. Like, what am I doing? Like, I'm turning down business, you know? Some of that stuff's outdated now, like tongue tie stuff. It's changed so much very recently, you know, just on simple levels. Now we have research about new things that we didn't have before. It's always kind of changing and evolving. So I tell people just be prepared for like learning a lot, but also make sure you implement it.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, episode number 212. My name is Andrew.
And this is Michelle. And welcome to our hygiene podcast.
Yeah, very, very glad to have you.
Yes, and it's really great that we are at our fourth.
This is our fourth one.
Voices of Dentistry, which is a conference for podcasters.
Yeah, it's pretty great. I think this year is going to be a banner year. Just looking around, how many tables are there? 20 some odd tables, and there's podcast equipment set up on every single one of them, ranging from our measly little stuff to some really high-end equipment next to us. That's embarrassing for us.
Yeah, but aren't we just a great example that you can rock out some excellent content with good audio with minimal equipment?
I think you want my answer to be yes on that one.
Well, look at our equipment compared to everyone else's.
No, that's true. That's true. That's true.
I mean, right next to us is Guitar Center Special.
Mm-hmm.
They bought that in a box.
They did. They probably helped assemble all of it as well.
Yeah.
So this is going to be part 4 coming up in a little bit. But before we get to the episode for part 4 of Myofunctional Therapy Series,
Mm-hmm.
not just any normal part 4, we had multiple times seen in the threads, what dental podcast should we be listening to, or what podcast should I be listening to? So there's a lot of really great podcasts, and every now and again, you and I revisit some of the ones that we're listening to. We've gotten a little bit into some of the marketing podcasts lately.
Right. We've really branched out.
I still love the comedy, though.
Well, that's because it's easy, right?
Like, 2 Bears, 1 Cave is
you
the
do love
most.
That one.
It is the most obnoxiously crude, hilarious, real show that I've listened to in a long time.
Okay,
I like
give
Conan
it a try.
too. Yeah, I mean, there are things I think that are still going to be a little bit, if you're a sensitive person, you're not going to want to listen to it. We don't need to get into it.
No.
So we've kind of branched out.
Yep.
Thank you first to Alex Bayer, Aaron Fetterman, and Rebecca Rose. That's my first 3.
Okay. And what he's talking about is on these Facebook forums, people start going like, hey, what's your favorite podcast? Or what podcasts are out there? I'm new to this, or, you know, something like that. And these are the amazing people that will either tag us or mention us, A Tale of Two Hygienists. And we're really grateful for that.
Yeah, it's super nice of them. Chelsea Long Holiday is another one. Thank you so much for that. Lisa M. Harris, thank you. And also Serena Gardner. She said, Tell Two Hygienists, and a bunch of comedy podcasts. And we also have, of course, Kate T.
Yes, Kate. Oh,
she's just the best.
Adore her. One day we'll meet you in person.
And then Hannah Knight Witten. She said A Tale of Two Hygienists as well.
Yes.
Amanda Elizabeth. And I'm really sorry, but Berthayu. Oh, I'm so sorry. We just lost a listener. But Amanda Elizabeth with the last name B, I appreciate that. And then, of course, we have another Amanda.
Yes.
Amanda Hill. And she was giving the Dental Podcast Network a plug. So thank you everyone for always supporting us in the social media.
So true.
So I think that's one of the main ways people find us, right?
Well, that's the only way we grew in the beginning, right?
Yeah.
Like word of mouth and social media posts. We didn't have a website. We didn't do anything.
Until last year.
Until last year.
Yeah.
Like 4 years ago. Hello. 4 years ago when we decided to like be an actual real business and stuff.
Yeah.
But this has always been a labor of love and a love of giving you content and just disseminating current information in a real fun and obtainable way for free.
Yeah.
And that was our big thing is we want to tell you what we're learning and the cool people that are teaching us at these conferences. So here you go.
I don't know if I ever shared this one with you because I think I got it last night, but there is an email that I got very specific to this Myofunctional Therapy Series, Airway/Myofunction. It's from Stephanie, and she said, "Thank you so much for bringing this content to the podcast. I have been in hygiene for 30 years. The episodes on airway and myofunction have been fantastic. I wish I had known this information at the beginning of my career. It all makes perfect sense to me. I hope to help as many patients as I can before the last leg of my career with this new understanding. Thanks again for using your platform to bring interesting topics that benefit newbie as well as the seasoned RDHs." From Stephanie Moore.
You know, I have gotten a ton of emails and direct messages and claps on social media. I know you don't know what that is, but like when we put something on a story, around this myofunctional series.
Yeah.
And I know I pretty much run our social media between Brittany and I. We're the ones doing it. So you probably don't even know
when it's not me behind the scenes.
Yeah. You probably don't even know when I say really big, bold statements and under our brand together.
I don't know what any of that means.
But the other day I said, I was listening to part 3, and you're about to hear the final one today. But part 3, after I listened to it on my way to see patients, I was like, I am very sad that this information isn't the foundation of our education, dental and hygiene.
Yeah.
I think before pick up a scaler, before you understand even what a cavity is, you should understand tongue positioning, the function of the tongue, swallowing. So embryology, like...
I was just going to come back to that.
Yeah, embryology.
And
I get like tooth buds, blah, blah, blah. Like this is when it forms. I could not tell you.
But it needs to be the next step, though.
Yes, exactly.
Like that's great to have that foundational knowledge, but then, okay, now part 2. But for you, was embryology, histology part of the prereqs? Was that part of the program?
It was like semester 1.
I feel like that's when ours was too.
And it was tied with the preclinical, like where you were like, this is a probe.
Yeah.
This is a scalar. This is a, explorer kind of course where you practiced on each other for a really long time.
Did you have a hygiene instructor teach that, or was it a member of the science department?
Hygiene.
Ours was science.
Interesting.
Yeah, it was the same person that does like the AMP and stuff like that.
No, mine were very separate. My head and neck was even taught in my hygiene.
Ours wasn't either. It was also the biology department or whatever, science department.
Interesting.
So they had, obviously they knew what was important because there was some information coming in, but it was driven by that instructor, not by the hygiene program. And so even all the nerve pathways and all that, it's like the head and neck was more all-encompassing of any of the professions that would need that information.
Yeah, that's interesting.
I don't know if it's better or worse.
I don't either. Maybe that's probably teacher dependent too.
Well, we got less fatigue, I think, from our teachers because we had a different outside instructor in a very heavy, weighty course.
Yeah.
So
I just keep thinking, we talk disease and pH and blah, 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 and so many other factors would help control that. If the tongue was in the right place, if the frenums were discussed, grinding, we got everybody in a guard. I look back and I'm like, this should be 101 before I even know what a suction is, before I know what a dental mirror is, before I know what a scaler is. Proper function, what does that look like and how do I identify it? Because that's really the driver of a lot of disease.
I feel like there's going to be a program out there that hears this and does kind of like revolutionize the way, and it doesn't necessarily have to be, it's going to be adding more information, but just changing the way that it's taught.
Yeah.
Making something that's a little bit more linear, which, how much I love.
You love that.
Chronological order. Oh, and I was going to mention, I totally forgot. So you were talking about part 3. Part 2 I was listening to, and I was like, let me check out Sarah's like webpage. And
oh, it's so good,
stuff.
Isn't it?
There is a video I want everyone to watch.
Oh, okay, yeah.
It is with the founder of the Myofunctional, and it's short. It's 10 minutes. It's very easy to digest, and there's not like, oh my gosh, all the science that's being taken away, but it just kind of reconfirms like the whole behind the scenes of why this is important. Someone who gets it on that level, and as you're watching them in their face explain it, is different than maybe even a podcast, which I think a podcast is very compelling.
Yeah.
But watching someone with their face and they know it to be true, you feel it yourself. Okay, so on that note, I don't even know where we left off, but just so you know,
check out Sarah's website.
I really wanted everyone to know what happened just now.
What?
How you went to this deep dive and we had to edit all that out, and then you couldn't produce results and you failed.
Wow.
And now I want to go into a positive, happy, into the episode part.
Way to shame me and my attempt at finding the video that I just watched the other day, and I thought our audience would love to know about it. Gina sent it to me. Maybe I'll put it in a show note if I find it. If I can log into my Google Drive eventually, I will get that. It was all about, it watched air go in through the nose, and then it showed you like from profile and straight on when the tongue drops, like what's happening.
I feel like I've seen that.
It was probably the better animated film that I've seen on nasal breathing versus mouth breathing.
Mm-hmm.
So if I can find that for you guys, I would love to share it with you. The Myofunctional series, it feels like a lot, but I mean, Sarah she did an amazing job breaking it down for us. I think it's all about the seed, planting the seed and finding the referrals.
Yeah, for sure.
So that part's easy, I think. Easy enough-ish.
I think it depends on where you live.
That's true. But she does a lot of Skype, and a lot of people are doing video assessments.
That's true.
So we hope that you have enjoyed this 4-part series. Thank you again to Sarah Hornsby for coming on and doing this and just sharing all of her amazing knowledge. We appreciate you so much for that. And we hope you enjoyed this final episode with Sarah Hornsby.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine. Well, listeners, welcome back to the final episode in this series on myofunctional therapy. Thank you again to Sarah Hornsby for coming on and sharing all of her knowledge. I've learned a lot in this series, and I'm sure our audience has as well. How are you feeling?
I'm good. Yeah. I mean, I love talking about this stuff and sharing it. And like my passion over the years has become education. So whether that's patient education or educating other healthcare providers, not from like I know everything type of way, but just like, I think it's so important to get this information out. So I'm just happy that you have me on here and that we're talking about it, because now the information can grow and spread, and that helps all of us. So
yes. And if you have listened to this series and it has really resonated with you, share it. Tell everyone about it. Really kind of help us spread the word, because it's not good just living here on the internet without being listened to. So spread the word. We would love that.
Yeah, that would be awesome.
And so what we're going to finish this series with is, how do you do it? What does this look like as a practitioner? How do you develop a business, or how do you integrate this into even a clinic or a private practice? And we're going to discuss a little bit about online therapy as well. So I would love to hear where you kind of started with your journey.
Yeah. So we talked about it a little bit more from like how I got into the field, but we didn't really talk about my practice and how that kind of evolved, because I started my practice in Seattle. That's where I'm from. And I practiced in so many different ways. And I think my story helps hygienists understand that this field is it's pretty open to whatever works. I've started practicing myofunctional therapy working out of an orthodontist office. So this orthodontist had also taken myofunctional therapy training, and she lived about a 2-hour drive north of me. And so it was amazing, but it was also really challenging. So I would do a whole day of hygiene, and then I would drive up there and see like 1 or 2 patients. And I would go up on Saturdays or Sundays. But I was just valuable that somebody was interested in this stuff and that she knew me, and she was like happy to refer her patients. But the catch was like, I didn't have an office. I was brand new. I didn't have anywhere to like see them. And so I would drive up there, and it worked really well. I used that as kind of a model. When I would meet with other orthodontists, I would just kind of drop the hint and say, well, I do work out of this one dental office, this one orthodontist. I see her patients on Fridays, or, I just look back and all these amazing doctors who just they're like, here's the code to my building. Here's the keys. A lot of them didn't know me that well. They just let me come see their patients when their office was closed, and they trusted me so much. And I mean, I'm so thankful to those doctors who helped me get started. So I started doing it out of like 3 or 4 different orthodontic offices. And the problem is, like, if you're working out of one orthodontic office, other orthodontists don't necessarily want to refer to you. So that's why I started doing multiple offices. And that's also when I started experimenting with like different ways of doing therapy. So I had heard people doing it out of their house. I tried that. I probably saw 3 or 4 patients out of my house before I just realized I was like, I feel like this is kind of sketchy. For me personally, I don't know. I didn't like the idea of patients knowing where I live and like all the details about like my house and like
separation,
I don't know. So
right?
Separation, exactly. And I did have the way my house was set up, I had like a separate entrance downstairs with an office and a bathroom. And so they never had to go into like my living room or anything like that. But I don't know. It didn't resonate with me. A lot of speech pathologists do it, and occupational therapists will do that. And so that's where I got the idea. And then I decided that I just need to open my own practice. So my own office space, and get people to refer to me. So I'll have like a real address, a real place. And that was in about 2013. I would say early 2013. 2013 was like the year I really built my own practice. It was a cute little office space. It was like super affordable. It was in a shared, it's a building called Active Space, which is like, it was offices where there were people in my building who were like architects or just self-employed people who needed a place to work away from home. There was a psychic, there was like artists, there was like all like sorts of people who just rent, and it's just space to rent. Mm-hmm. And it was really cool because it wasn't a medical dental building, but you could do anything. It was just a blank slate. You could paint it. You could, like, I had a couch, and like, it looked like it was so tiny. People loved it. People came in, and kids like felt like they're like in a fort, so they would take off their shoes. I had a fuzzy carpet. They would sit on the floor and play with the games. And it was my first office where I just felt like this is like my space, and I loved going there. It was so cool. So it was like my own myofunctional therapy office. And honestly, now that I think, it must have been 2012 that I did that. I lose track of the timeline. Yeah. But so I practiced there, and I saw patients in person for, I would say almost 5 years, probably 4 years. And then by the end of 2014, I had figured out that people like to contact me online from other states and other cities. And I was really resistant in the beginning to try to do therapy online, but I felt like it was one of those like signs from the universe, like, so many people are contacting me and I'm turning them away. Like, what am I doing? Like, I'm turning down business, So I just thought, I need to figure out this whole Skype thing. And, I was like, I'll try to figure it out. So I started offering people incentives. Like, I would give them discounts if they wanted to see me online. And so I was transitioning. And then by the end of like mid 2014, I decided to take my practice fully online and close down my actual office. So from that point forward, I just was an online practitioner. And that was weird, especially back then. I mean, 2014 was not like internet wise 2019 is. Like 5 years ago, internet speeds were a lot slower. People were not as open to that idea. I feel like a lot's changed, like with FaceTime and stuff. People are like, oh, I do that all the time. I did lose a couple referral sources, but I kind of knew that would happen. But I thought, you know what, there's enough interest. I can make up for this. because the demand was there. Even the patients locally, like Seattle has a ton of traffic. And if you live in North Seattle and I'm in West Seattle, it can take 45 minutes. You know, people were like, can I just meet with you online every other session? And so I could see the demand, and I felt like I just filled a void that was there. Yeah. So that's how I started doing online therapy.
I feel that pain. We started this podcast in 2015, and now saying podcast to somebody, it's so much easier than it's not online. Like it just it's so much
people know what podcasts
they
are.
Actually they know where to find it. They know how to listen for the most part. So I'm curious then about scope of practice as a dental hygienist. How do you integrate this into your scope, or is there even does this fit at all under that umbrella of being a dental hygienist?
It does. And this is where things do get a little complex and complicated and controversial. All the C's, I guess. So the American Dental Hygienists Association, we have myofunctional therapy in our bylaws. It's in our scope of practice through that organization and entity. So it's recognized and it's mentioned. You know, I wish I could pull up the little, you know, what do you call it? The little addendum or whatever that has it. But basically what's happened for decades is that myofunctional therapy has flown under the radar and no one's really paid that much attention to it. There's so few hygienists doing it that I think it was just like, just leave those weirdos alone. It never really got
no harm, no
much
foul.
attention. No harm, no foul. Just let them do it. So now that there are quite a few hygienists getting training and organizations popping up, and now is in the past couple of years, hygienists have been reaching out to their dental boards in their states where they practice and say, I want to follow all the rules. Like, I think hygienists are they want to make sure they're doing the right thing. They want to they don't want to do anything illegal or bad or wrong, you know? And so for the longest time, the myofunctional therapist kind of had this understanding of just don't open that Pandora's box. Don't contact the dental boards. Let's just keep flying under the radar. But now it's to the point where we've had to. So what's happening is each state, and I talked to, I'm licensed in Washington State. So I talked with the Washington State Dental Hygiene Association president. Her name's Jennifer Zabar. I can't say her last name. It starts with a Z.
Yep.
And she was really interesting to talk to because she said, we've got bigger battles to fight. We are trying to push, we've got these agendas that we're trying to push through legislature, through the Capitol for, sole practitioner hygienists. And she's like, myofunctional therapy is not really on our radar. So what we've discussed as a board is that if you're practicing doing myofunctional therapy in a dental office, you have to follow all your dental hygiene scope of practice things. That means, you have to be practicing with dentist supervision. You have to follow all those rules. But here's the kicker. She said, if you're not practicing out of a dental office, you're not a hygienist. You don't have a scope of practice. You're just a person doing this therapy and do what you want. We're not overseeing you when you do myofunctional therapy. So this is kind of the awkward stance that a lot of states are taking. So they're saying you're not a hygienist when you're doing that. So that means, that opens up a lot of questions. Yeah. So that means that, well, the field's pretty open then. Who else could do this? If I'm just a regular old person off the street when I do myofunctional therapy, who else could do it? So this is where there becomes a controversy between speech pathologists and hygienists, because speech pathologists they can't really separate the myofunctional from the speech because it's so integrated. It's harder for them to separate their licensure that way. For me, if I'm seeing a patient online, just like me and you are talking, there is no way I'm doing hygiene. It's they're so different. I'm not even connected to being a hygienist while I'm doing this kind of thing, although that is my training and my license and my background. So speech pathologists don't really like that. And I can understand why, because they're much more restricted. Technically, you should only see patients in the state where you're licensed, right? That's technically, but I see patients from all over the different states and all over the world. And so that gets it's a gray area and it's just not regulated right now. And honestly, if it gets regulated to the point where as a hygienist in Washington State, I can only see patients online in Washington State, I'm happy to abide by that. I get it. Hygienists in a lot of states, or the dental organizations in a lot of states aren't claiming myofunctional therapy. So although you can get training, you're not a hygienist when you do it. And so that's the stance they're taking. I would much rather have them have the stance where they're embracing it and bring it in. Like, let's integrate this into the education. Let's get this, like, let's claim this as a dental profession, hygienist or dentist. Like, let's claim this. Let's bring it under our scope. So that way, we can be more like united, and it doesn't get like, the last thing I want is like a big giant conglomerate corporation to come in, like, MyoCorp, and just start training myofunctional therapists, anyone who pays, and that kind of stuff is my fear, because that could happen. If a big enough company with enough money wants to just start training anyone, they could. And right now we're all small organizations, it's like mom and pop organizations, like training people. It's kind of how it is. It just opens a lot of awkward doors. I don't have the answers, but I just know that there's going to be some changes in the few years, and I don't know what they look like, but right now it's pretty open. So for hygienists who are uncomfortable with that, I just say, well, then practice in your state. Don't see people online. Online myofunctional therapy is not for everyone. It's a skill set that I feel like I've really honed in on. I'm good at it. Like, not trying to toot my own horn, but like, I've had to get good at it. I've tried so many things. Like, it comes down to, like, you have to know technology. You have to understand, lighting, like, you can't just work with people in the dark. You have to understand how to help a patient work through the technical side of, like, I can't figure out why my camera's not working. Connecting with someone through a computer screen is way harder than connecting with somebody in person in the same room. And so I understand why online therapy can get criticized, because not everyone can do that. And if you're somebody just, you can't do it, you're like, no one can do that. It's impossible. And so I get where the criticism comes from, but I think I have a lot of really happy patients. I feel like I'm filling a void that needed to be filled. I'm doing the absolute best job that I can for my patients. And so anyone who, criticizes, like, you can't do therapy online, I say, well, come watch me, come do it with me. Like, you can see what I do, because I think it's really effective and it works really well, and it's helping a lot of people. So that's my kind of stance.
Yeah. Gosh, I have so many things whirling around in my head. One of the questions that I had written down was like pushback. I see so many pros and cons.
There's
to what
so many.
you
Yeah.
just said, as far as even like integrating it into our scope of practice, because I mean, to be very honest, I don't want to pick on some states like Texas and North Carolina, but I wouldn't want that in their scope, because God, they're so limited. So if you do have a state practice act that is, let's say they put this myofunction, like, I have a feeling they would cap it in such a weird way that you couldn't actually reach out and help people.
I never thought of that.
Because you are in such a wonderful state that allows you to expand your practice. And I'm in South Carolina, and our scope is okay, but we're still very limited in a lot of ways. I can't do lasers. I can't do blocks, quote unquote blocks.
Interesting.
I can infiltrate.
Okay.
I can do things like that, but I'm limited still as a hygienist. So I kind of don't want it to be in my scope of practice here, because I think they would say I couldn't do online. I couldn't do that. They would put this cap on something. However, I do see the con of not being regulated in some way, because then you could get, Joe Schmo off the side of the street that takes that 4-day course and calls himself a myofunctional therapist. Then people are getting jaded because they're not getting the right care, the proper care. They're not being successful. God forbid something else goes wrong. Like, I don't even know.
Luckily,
what happened.
Yeah, at this point, all the organizations they have pretty high standards of who they'll train. I don't know any myofunctional therapy training organization who's just willing to train, like, oh, I'm just a mom who's interested. I have them ask me all the time. I mean, you don't even know, like, these moms and parents and even patients who have symptoms, they're like, can I train to become a myofunctional therapist? And I'm just like, no, you can't. I'm not going to say, no. I'm like, you have to know the mouth, and you have to, like, understand, you have to have a degree in, like, something health related at the very least. I think dental or speech are really the most optimal, because we have knowledge of the mouth. I still think a physical therapist can probably do really well.
Occupational therapy, I would imagine.
Occupational. Yeah, for sure. So I think there's room for lots of professions, but yeah, the scope of practice thing gets super tricky. And this is where there's a lot of, in the field a lot of misinformation, because I get it. Like, the organizations don't want that to be like, that sounds kind of bad. Like, oh, this isn't regulated, anyone can do it. And so they've made it sound like it's very regulated. And I just think, be honest with people. Like, it is open. Don't try to make it sound like way more, I want to say like legitimate, but it is legitimate. But it's not as far along as people think it is. Like, think about what it takes to get a dental hygiene license and a degree. Like, you have to go to school, you have to pass your board exam, like a written and a, didactic. It's like very intense training, and the training is separated from the school, where you learn. And then the licensure is connected to the state. And then the board is separate from all of those things. So we have like 4 entities that you're going through to get like checked off on, to get a license and to get like all of these things. So myofunctional therapy right now, I mean, you can take any course from anyone and then do it the next day. And it's good because the information is getting out there, but I also see the problems and the limitations around that as like time goes on and the big picture. And so I think as long as people know that, like, knowledge is power, like, just know that that's the state of it. And you can decide if you're okay with that or not. Like, I'm okay. Like, I love it. I'm okay. Like, being in a gray zone, I'm fine with. But there's some people who really like that black and white. And I don't think, you just won't find it in this field.
So I would love to talk about patient selection. And you said you don't work with children so much. So is there like a window, like a little space that you kind of, a niche, if you will, like that you go into? Also, what does patient selection look like as you really start to learn? Like, what's the low hanging fruit for a new myofunctional therapist?
I would say new therapists, and this is the way I started, new therapists, you get the patients with the doctors you network with. So I was going around to orthodontists and pediatric dentists because I just felt like that was the easiest to explain. And also in the early days, we didn't have the sleep disorder breathing connection. Like, that just wasn't there. It was all about open bites and habits and tongue thrusts. And it wasn't really as big picture. So I used to see mostly kids. I would say like 80% kids, 20% adults. And that was because those were the people who were referring to me. But those are the easy ones, like the kid with the open bite, the kid with the tongue thrust and mouth breathing. That's where most therapists start. Most don't want to take on a chronic pain patient or a severe sleep apnea patient. And so the odd thing is that as my career evolved and I saw more and more patients and I had more articles or videos, I don't know, those people started to find me. And I'm not really sure how it happened, but I just discovered I loved working with those patients. Kids are in the absolute optimal position to get the most benefits, but they haven't lived with symptoms and they don't have the ability to understand like long-term consequences of not fixing issues. So what I love about working with adults who have tried everything is they will do anything, and some will pay anything, they want to change. They will do whatever I tell them times 10, and so I love working with the people who are that motivated. And that's really why it's become kind of my area of expertise or specialty or what I'm passionate about. And also I think because I found this as an adult. And so my personal like story connecting to the field is like, I'm an adult with these things. Why did no one tell me? Like, my facial structure, my airway, everything would be so different if my mom knew this stuff and could have helped me when I was a kid. So I think I just connect with that. Maybe if I had kids with these issues, then I would connect more with the pediatric side of things. But I think just that personal connection is what's kind of driven me. And then the motivation of those adult patients. So what I'm telling a lot of my students, those hygienists who go through my program, is specialize, pick out, like, if you love babies, find a way to work with babies and lactation. And there's so much opportunity in this field. You can do what you want. If you love kids and pediatrics, specialize in them. If you love adults, specialize in them. If you want to do orthodontic stuff or TMD stuff, like, you can choose that path now and you can specialize in that. I do think it's possible now, today. You don't have to see everyone, although you can. Some like to just see whoever comes to them, and I don't turn people away. Sometimes I just refer, like, if I'm like, now I'm so lucky I have this network of all these myofunctional therapists who I know through my program. And when I get a 4-year-old, I refer to Carice in New Jersey. She's done my training. She's done a lot of other training, and she's awesome with kids. That's her focus. And so if I get someone under 4, I'm like, hey, Carice can help you. I know her. She's awesome. Like, talk to her. Yeah, that's easier for me. But it also, I think, allows patients to get like more specific help. I know a lot about the babies and the kids, but it doesn't mean that I'm like the best person for that mom to see, So case selection, though, as far as just like who to take on, I think as a therapist, this is one of the hardest lessons to learn. And that is like, you don't want to take the people you have to convince and you win them over. They're going to be your hardest patients because they didn't have that self-motivation. You did a really good job at convincing them that they need this therapy and convincing them that their symptoms are an issue, but they don't have that personal drive and connection. And so therapy is hard. It's not an easy walk in the park. Like, you have to be committed. I mean, I take people through, and we can kind of transition into what my treatment is, but I take patients through a program, and it's an average of 12 sessions. I call it a 12-session program, although some patients might need 10 sessions, some might need 15. I know that 12 is about that number, and I don't do session by session with people. I don't let them just try out 3 and see if they like it. I've done that in the beginning, but at this point, like, I'm an established, experienced therapist. I have a waiting list down the road. Like, if people don't want to commit and they don't want to like do it all the way, I say, that's okay. There's tons of other therapists out there. You can go find them. But this is how I do treatment. So I kind of am in that spot where I have that luxury now, but it's so hard to take on patients who aren't motivated internally. Like, their orthodontist said they have to do it, or you say they have to do it. And this applies to anything. I mean, perio, everything.
Right.
So,
yeah. So with those patients that you take on for the 12 series, and you're doing it without giving away your like secret sauce of success there, like, what does...
I'm happy to give away anything.
You're the ones that we love to bring on the podcast, because scarcity does not scare you.
Yeah, no, it doesn't.
You. But I'm just curious, like, how much work and planning do you have to put into? Is there like treatment planning that you have to do? You take case by case, or is it pretty much like here's like the first 3 are pretty standard, and then it gets more case by case? How does that, or is it all different?
It's all pretty different, but I'll tell you, so like, to walk through like a treatment with me. So people either get referred or they find me. And I've changed this. I don't offer free assessments anymore, but I really feel like I built my practice on offering free information. So I would meet with people for a free 30-minute assessment. Part of that was because I was online and it's a field that people don't know. And I just felt like if I can connect with people and give them this information, then, and there's no risk involved, they don't have to sign up. They don't have to do, it's like, no risk, guarantee, kind of whatever. So they would meet with me, and I would just kind of say, yes, I can see that your kid's tongue tied, and just have a conversation about all the stuff. Then I would say, if you want to work with me, the next step is a 90-minute full evaluation. You have to send me pictures. It's much more formal. The free assessment's just a conversation. With that, it's a whole workup, and it's time consuming, but it's mostly patient education. I could see in that first 30-minute appointment that the patient needs therapy. That's easy. But going through all the nitty-gritty details, assessing for airway issues, talking about this stuff, and like the long-term, what if you don't fix it? It's not a quick fix, so you need 12 sessions. Like, that discussion for me was what happened in that 90-minute appointment. So I would give patients the cost of that all up front. So for years and years, I charged $75 for my full evaluation, which I think is like so low. But at the time, that's really what people would pay, because
they didn't see the value yet.
Yeah, they didn't see the value, but also a lot of people do free evaluations. And so what I learned is that patients, like, they have to pay something because they don't value it otherwise. But I don't want to make it so high that people don't even want to pay. They don't want to take the risk. So 75 was like that sweet spot where if it was 150 or whatever, people would be like, oh, it's like too much of a barrier. So I chose 75 like very strategically, because most people will spend $75, right? I mean, that's like, if it's a 90-minute appointment, I feel like that's a pretty affordable thing. People will do it. And I knew if they got the information from this evaluation, then chances are they'd probably sign up for the therapy. So my 12-session program for years and years was $200 a session, so $2,400. And I always gave people discounts. So I would always give 10% off if you decide to pay in full. So you can see if you do the math, if you start 10 people a month and they all pay in full, it adds up and it can become a pretty, I think you can really replace your hygiene salary pretty easily with just seeing a few patients a month. And not everyone pays in full, but in my case, I would say 90% would. And with the others, I would make payment plans. And the sessions are usually 30 to 45 minutes. And it worked out well. And I think it's a lot of hygienists who want to get into this, that's always what they want to know. Does this pay better than dental hygiene? And I think, yes, it does. The average rate across the country is going to vary depending on your city, but a therapy session should cost between $100 and $200 a session. That should be what it is. And they're usually anywhere from 30 to 45. Some people do an hour, but I think you don't really need a full hour for most patients, but that's really how therapy should work. For me, doing the program was that I don't like starting stuff and not finishing it. So if patients aren't committed, if they're like, I just want to try it and see if I like it, you can't change habits from one appointment. You can't really, so much of this is like practicing and habits and checking in and awareness. Like you can't just do a couple sessions and then be like, oh, that didn't really work. And so that's what I didn't like when I tried just doing session by session in the early days. People get tired and after the 5th or 6th session, they're like, we gave up on that. But then they don't actually get results. So now I use it as, it's almost like reverse psychology. Like I say, this is a lot of work. This is hard. This takes time. It's not a quick fix. And people are like, oh, no, we totally get it. We understand. We're on board for the full thing. And that's the type of person I want to sign up, not the ones who are like, do I have to? So anyway, that's a lot of stuff. Maybe you have questions on some of that stuff I just said.
What about the billing of this? So you're direct charging. Is there any kind of like a medical or dental billing that goes with this?
Medical insurance is starting to cover it more and more. And this is where I think it also gets a little tricky with that license and scope of practice stuff. So outside of the state of Washington, I don't bill people's insurance. I just say, hey, I'm out of state. I just don't want to be in that situation where I'm like, I'm not licensed, but I'm like billing insurance. Like that's just too crazy. So you can see how that opens up problems. Oh, yeah. So in Washington state, I will bill people's medical insurance and I don't bill them. What I do is I give people a super bill with codes, and medical insurance is super complicated. So I'm not an expert in it, but I know the codes that people in the field use, and I know kind of the tricks that people in the field use. But I tell patients, don't expect this is going to be covered. Mm-hmm. And I leave it up to the patient to do the legwork. And I tell them this up front. I'm like, I can give you the codes. I'll give you a super bill. I can't communicate with your insurance directly. It's too much work. It's so hard. It's so time consuming. If you tell me what you need, I can give it to you, but I want all the communication to be between you and your insurance company. And I need to be out of that loop. So that works. And what I've learned is most people, they pay for it up front and then it's kind of out of sight, out of mind. They'll call their insurance and then it's just like, they kind of like, oh yeah, I tried submitting it, but they denied it. And then I just never got around to cause you can appeal it. Like I've had very few patients who are committed enough to fully go through the process and jump through the hoops of medical insurance. And, the ones who do, usually they get some good coverage, but it's like a lot of work and it's something I can't take on. It's a lot. Yeah. So, patients get it. And most people who contact me, they're like, this isn't covered by insurance, is it? I'm like, not really. So I don't think anybody who reaches out to me is expecting like, oh yeah, insurance is going to totally get what this is and cover it fully. No one's really expecting that. And so, I think that makes it easier. And I feel like too, in dentistry, we're so insurance nervous that telling patients insurance doesn't cover it is so scary for us that I think it sets us up for failure with patients. Like, I'm just like, no, it's not covered and people don't expect it. So I don't know.
That's interesting. I'm also curious about the underserved, lower socioeconomic population. And do you know of anyone who has kind of integrated this into caring for that population of patients.
Yeah.
Oh, that's great, because I often hear, even in this airway world, it's really frustrating for me to see the patient population that I see right now and not have anywhere to send them, because this does feel like a little bit more of a upper
It's expensive.
class.
Yeah, it is.
You have to have a disposable income of some sort to be able to afford a lot of these newer therapies out there. So I'm really curious how this has been implemented in the population that I think probably needs it the most.
Needs it the most. Yeah. So this has been like one of my struggles is like, me starting this business, like, and all the time and education that, like I want to be paid for my time and my knowledge. And like, I'm so torn because I do have people reach out to me all the time. And especially in the early days, now I just feel like people just, I don't know, people who find me and who want to work with me, like the money isn't really their thing anymore. But in the early days, I always was faced with that decision. And, I took on a lot of patients and didn't get paid for a lot. And so I did get a little bit like jaded and scarred because, you can get burnt out when you're just always trying to help people, but you're not making any money. And so I feel like that has to be balanced out. So what I've done is I take on 1 or 2 pro bono cases a year. I just feel good about doing that. I feel better doing that from people that I really think have a need. So I don't advertise that. I don't say that. But if someone reaches out to me and they've got a kid or themselves and they've just got like, I just am like, this person needs help and they can't afford it. I do 1 or 2 a year, but I've also, this is where I've started to get really creative with my students is I have all of these resources, these hygienists who've gone through my mentoring program and they're all like, I don't know what I'm doing. I need help. I need to see patients, but I'm scared. And so I've used that dental hygiene school model and I've said, all right, I'm going to pair patients who can't afford to pay a lot for therapy with students who have never seen patients and do that like dental hygiene school model where like it's lower, more affordable treatment meshed with people who need experience. And then I match them with a graduate who has more experience and who's already, been doing therapy for a couple of years. So it's like the perfect triad. It's the patient who needs it, the student who needs this experience, and the graduate who now gets to mentor somebody new. And so they all feel like they're getting something out of it. And I feel like it's a really cool program I've put together in the past like year and a half. And I've had a hard time kind of explaining it and getting it out there. But if you look on one of my websites, it's called the Matchmaker Program. I also have ways that it can be sponsored. So it's $1,100, which it's so hard to get these costs to go down, but it's as many sessions as you need. It's working with the student. I have to pay the graduate. I'm like, this is where maybe I should get them to volunteer. But the hard part is there's this fine balance between low cost and low value. And so originally when I started doing this, and I'm still trying to play with the cost, this is like, it is my dilemma is like how to get this accessible to people. Originally I was charging $600 for it. And patients didn't show up. The therapist never got complete therapy.
$600 and they still didn't show up.
Wow. They'd do 3 or 4 sessions and they'd drop off the radar. We'd never hear from them again. They would just never practice. They would like miss sessions. And I was like, man, $600, like that doesn't seem just like,
that's not an easy chunk to change. Yeah.
Yeah. And so, then I bumped it to 900 and now we're at 1,100. This program is like so much work. I do not make any money I feel like I lose money from this program, but I feel like it's important. But what I need to figure out how to do is like get it to the point where like, I feel like 1,100 is still high, but because of all the moving parts and stuff like that, I just haven't figured out how to get the cost down, but it's better than most therapy. I think that includes the evaluation and all the therapy. And so I think it comes to like $60 a session, something like that, compared to 100 or 200. It's better. But yeah, it's one of those things. If you have any ideas, like I feel like those students, like the students don't get paid, the patient pays. I have the opportunity for like a doctor or, like somebody to sponsor like half of that or part of that or all of that. But yeah, it's something I like to think about a ton. Like, how do we make this more, like, how do we get it out there?
Well, that's the constant conundrum, right? How do you engage patients to be accountable
for their own practices. And I mean, I'm like that too, where I'm like gung ho in the beginning and then life just happens. And I don't know. I don't think any of us really have that big answer, but sounds like you're putting in the footwork to find.
I'm trying and taking on the pro bono cases. I feel like that's helpful. Like I can kind of give back a little bit, but it is this program. I need to evolve it more, but I just, I've got a million different things I'm doing. So I kind of have left that like for a little while.
Yeah.
But I feel like it gives people at least some more of an opportunity, but it would be great to get even lower cost, like $25 a session or something like that, just for people who, or free. It's just so hard to give free. I really struggle with like free treatment because people are just like, oh, it's free. Who cares? And so I feel like there has to be some dollar amount attached to it. If we could get it down like $25 a session, that'd be really good.
Yeah. So what does continuing ed look like for you? And I say for you, but for Myo, because I feel like you are like me where I would just
I do everything.
Take 1 million courses, just say like a sponge with content. But for the everyday person who's in the trenches every day, not teaching it necessarily, but like how much continuing ed and how much cost does it go into actually getting your license or I guess your education?
Training. Yeah. I would say most courses are around like $2,000 to $3,000. Like that would be the initial, the 4-day course or the program, that kind of thing. But continuing education, I think if you're part of like the IAOM, I know they require continuing education and it has to be like an IAOM approved course. So there's always people offering that kind of stuff. I don't know the hours they require. I think personally, if you're going to get into this field, like you have to just be mentally prepared for a lifelong or at least couple year long learning journey because it's a lot of information and it's always changing. We've got so much, like this field is moving so fast. Things that I did when I was a new therapist getting started, some of that stuff's outdated now, like tongue tie stuff. It's changed so much very recently, just on simple levels. Now we have research about new things that we didn't have before. It's always kind of changing and evolving. So I tell people just be prepared for like learning a lot, but also make sure you implement it. This is the biggest thing is it's easy to read 1 million books and take 1 million courses. But if you don't apply the knowledge and see some patients or talk to some doctors or put on a study club or, do something to actually take steps to move you forward. If this is what you want to do with your career, if all you want to do is learn and like talk to patients in your chair and be able to like refer to a therapist, that's fine. But if you actually want to be a myofunctional therapist, you're going to have to apply what you learned. So just know that it's not, think about how many years you're in dental hygiene school and then you come out and your first couple of years practicing, like you're still learning, right? Myofunctional therapy is like that too. I feel like you need a few years under your belt seeing patients before you really have a grounding in. You've got to see, I would say after 10 patients, you're going to be pretty good. Like, okay, I get the rhythm and the, how the treatment works. But it takes a lot. It takes just a lot of actual real life experience. And that's what makes you get better. So
it sounds like having a mentor during the first few years is just an absolute must.
It is, exactly. Which is, that's why I started that mentoring program I do, because that's what I wanted. And I felt like that's what was missing. And there were so many just little dumb questions I had that I was like, I don't know what to do or what should I charge or all that stuff. And so that's exactly where my program came from.
Anything else that you can think of that I haven't asked?
I don't think so. I think, the last message that you can kind of take away is we should all know about this. I think everyone in dentistry, hygienists or dentists, you should at the very least know about this and be able to refer for it. Just like for ortho or endo or perio, you can identify something in a patient and then tell them and refer them. You don't have to do it yourself, but if you want to, I'm happy to help. I'll give you all the links and resources so all the listeners can learn about the options for training and stuff like that, because it's a big field, or it's like there's a lot of information out there and it can be confusing. But at the very least, I think we should all be able to refer. So look for myofunctional therapists in your area, understand the basics of these concepts, even if you don't want to get into it yourself. I think it's super important stuff. It can help a lot of patients. So, or maybe yourself or your kids or significant others.
What I love is that we have a lot of new grads. We have a lot of students listening.
Oh, cool.
We even have a lot of people who have not even gotten into dental hygiene school yet, and they're just listening to see if they'll like it, which I think is
awesome.
fascinating. I think you're so smart to do that. So this sounds like another avenue, like if private practice just has never been like, and you're like, oh, that's not really what I want to do, working under a dentist or, a corporation. Or you didn't realize that there was any other way to practice as a hygienist.
Yeah.
But also, God, the burnout that we experience in this profession it's real and it's uncomfortable. And I've definitely gone through that where, man, did I pick the right profession? Like I am having a hard time. And I feel like things like this reignite that passion.
Totally.
And if you're done with that scale and polish way of life, there's just so much more.
This opens up tons of doors.
Yes.
And I know that you had Julia Worrell, and she does that whole airway advocate program. I mean, so many of us hygienists are passionate about education too. Like if you just want to get knowledge and talk about this stuff and share it in communities, I know that program is doing a lot of good. But the myofunctional therapy, it's really like, I'm not going to lie, I got into it, like I said, like I was just looking for something else. But I had the symptoms, I connected with it. And then that took me down this whole like path of like, I'm just super into it and passionate about it. And I want to learn about it. And it opened up other parts of health that I never knew about that I, like microbiome, and like, it just opens up all these, doors and it's amazing.
Yeah.
So.
No, and I think that this is a really wonderful place to kind of wrap up. And I have no doubt that this kind of resonated with somebody. I just learned at a conference that anybody who listens to CE takes CE, not so much with this podcast, because you got to be intrigued to sit and listen to a podcast. But 50% who attend a CE go for, they need the credit, they want the food. That is,
totally.
50%.
Or it's like, oh, it's a vacation. I'll go to Florida for a conference.
Good point too. 25% will leave inspired, but not really implement. Then you have the rest of the 25% that kind of like I think 5% will take action. So it's not very many, which that's fine. Like you said, this is just as long as you know and you can refer, that's huge. And you can help a lot of people that way. But there's going to be some people that this touches their soul, or maybe they implement it in there or with kids or friends or somebody, like they send them to you and they're like, oh my God, I see this works. And now I want to do it.
Yeah.
I think that this is a really wonderful topic. And I definitely appreciate all of the time that you've given to us and the listeners for this like 4 weeks of information that everyone's getting. So how many students do you take in your program?
The classes start off small, like, 5 to 10. And now they're growing. And I try to cap each one at 20 because I like that kind of hand-holding personal experience. I don't want it to feel like people are lost in the sea. My next mentoring program starts in January, but I do usually a few a year. So, if someone misses the January 2021, there's going to probably be one in March or April, I would say, down the road. As the demand has grown, I've had to do more and more. So that, I don't have the dates on any of those yet, but I can get them to you as they come out.
Yeah, that'd be great.
But I'm always happy to answer questions if people want to email me. I get a lot of emails, so I might not get back to you like immediately, but usually within 24 to 48 hours, I will. I'm happy to share this stuff. As your listeners can probably tell, I'm like obsessed and passionate about it. So, but I think, thank you for having me on here. It's been really great. So hopefully there's some seeds planted and some curiosity stirred.
At least they know the term myofunctional therapy. I agree with you. And you've said it a few times that it's
a trend right now. We're hearing more about it. You're getting people sent to you more frequently. I think it's going to be one of those things that if we don't know about this and a patient brings it to us, we're going to feel really kind of ashamed.
Yeah, I think that's what's driving a lot of it. Patients know about it. Patients want it. You should see how many people look at my YouTube channel. You know, patients are really interested. And then it is like if a patient comes to you, like I remember this with oil pulling years ago. I was like, I did not know what it was, but patients, it came up enough that I was like, I better figure this out. And so I think that's what's driving a lot of dentists and hygienists now to look into it is like patients keep asking about this weird therapy and I don't know what it is, or tongue ties are like that. So yeah, know about it at the very least. So that way when your patient asks you, you can have an answer.
Wow, that's great advice. Thank you so much. I am such a big fan. I love all that you're doing and the changes that you're making in the profession. And for those that would like to know more information, where can they find you?
You can Google me, Sarah Hornsby. I'm on Facebook, Instagram, YouTube. You can go to, I have 3 websites. Myfaceology.com is for my practice, which is more patient oriented. If you're interested in training or mentoring, myomentor.com is one website. And then my other website, sarahkhornsby.com is kind of the website I'm transitioning to as, I need more of like an umbrella website. So, but yeah, reach out to me on any of those platforms or follow me and, see what I'm up to. And, I'm sure I'll be staying in touch with you, Michelle, too. And maybe we can even do some other topic down the road sometime.
Would love that very much. Well, thank you again. I hope everyone enjoyed this series. I know I certainly have, and definitely reach out and at least start that conversation, plant those seeds with your patients. Thank you so much again, Sarah. We appreciate you.
Oh, yeah. All right. Thank you so much. Bye.
I think that was an amazing part 4 of the series.
Yes, for sure.
Thank you, Sarah. Really. And we are going to bring her on for an Instagram Live mid-February. I'll advertise that for you guys. She's going to come on. We're going to do an Instagram Live. So if you have questions, write them down. Go find us on Instagram if you aren't already following us, and we will answer all those questions real time.
I wish people could see, the movement.
Real time.
That's not going to translate in the podcast. But yeah, so what do we have coming up?
Well, we're going to Hinman, as you've been hearing.
Yes.
We'll be at that Hinman. I'm going to OSAP, literally this, on Sunday.
Right.
Before this episode actually goes out. While this episode is out, I'm at OSAP.
And this weekend, I will be at Yankee.
Yes, that's right.
Boston.
And BT Dubs, OSAP has a podcast on infection control and compliance on the Dental Podcast Network. So if you aren't already looking or listening to Channel 1, Channel 2, you should do that.
You know how you don't care about stats ever?
Yeah, ever.
It's one of the highest downloaded individual episodes on that channel.
What?
Yep.
I love hearing that.
Super popular. Well, I think it's because they have great takeaways, right? Every time Michelle brings it, she brings it. And she's like an engaging host. She's just fantastic. So don't miss that podcast. Dental Podcast Network is what you want to find. There's Channel 1 and Channel 2. Listen to them both.
Please do. And I think that's all the things that we're doing for a little minute before Before
midwinter, yeah.
Yeah. So Yankee, OSAP, midwinter, Hinman.
That's all.
And work 40 plus hours.
No biggie.
You have 3 kids. I have an aging dog. Which, by the way, do you see how much dog hair I have on me?
I was going to ask if you had a roller.
I'm just going to start making my clothes out of dog hair. It'd just be easier. It would save me time. It would save me money. It's going to start knitting with dog hair.
Cool. Well, I enjoyed this episode.
Yep. Everyone, thank you for listening in again another week. If you haven't already, hit that subscribe button, and we would love your rating and review. If iTunes or Apple Podcasts is your app of choice, please go figure out how to leave that review. We would very much appreciate that. And you are welcome to email us at ataleoftwohygienists@gmail.com, or you can head over to our website, ataleoftwohygienists.com, and you please follow us on Instagrams, on the gram, on the Facebook, on the LinkedIn.
That's what I'm going to do for 2020. I'm going to do the gram.
You heard it there. You heard it.
I'm also going to do the do.
You already do the energy drink.
Hairdo, not Mountain Dew.
All right. Well, this has been fun. Thanks, everyone.
Bye, everyone.
Bye, y'all.